The World Health Organization's director is hopeful the emergency phase of the coronavirus pandemic will be over in Europe in 2022. Europe and Central Asia are entering a new phase of the pandemic as the Omicron variant replaces the Delta variant, which is likely to lead to a more stable situation, according to Hans Kluge, director of the World Health Organization's Europe region. In a statement to the media on Monday, marking 2 years since the start of the pandemic, Kluge outlined what 2022 will look like for Europe. He said, "The pandemic is far from over, but I am hopeful we can end the emergency phase in 2022 and address other health threats that urgently require our attention." However, he warned despite the fact that Omicron is less dangerous, Delta challenges still lay ahead. Research has found Omicron is more transmissible than Delta, meaning infection rates are higher across the continent compared to previous waves. This in turn was still leading to increasing levels of hospitalizations. Although admissions to intensive care units were down. According to Kluge, Omicron accounts for 31.8% of cases in Europe compared to 15% the week before. Kluge went on to argue that health services were still being disrupted and vaccine disparity was a huge issue across the continent. He said, "Too many people who need the vaccine remain unvaccinated." This is helping to drive transmission, prolonging the pandemic and increasing the likelihood of new variants. Some European governments have discussed treating the disease as endemic once the Omicron wave has subsided. This would involve allowing the virus to circulate freely but focusing on protecting the elderly and vulnerable while the rest of society returns to a more normal way of living. Spain has announced it will begin treating coronavirus like other infectious diseases such as influenza. However, other health experts have taken a more cautious approach, emphasizing the need to continue to suppress cases in order to prevent a new possibly more dangerous variant.